Welcome to Startup Health TV. I'm Logan Plaster. What do most people do when they receive a scary diagnosis from their doctor? They Google it. Sometimes Dr. Google gives them useful things to read. Oftentimes, it sends them down a rabbit hole of misinformation and causes more harm than good. This was the problem that Andrew Rosenberg was seeking to address when he started Responsum, a company that's been with Startup Health since 2019. Responsum works directly with patient advocacy groups to curate knowledge around specific diseases. Let's say you've got kidney disease, for example. You can use the Responsum app to find vetted information as well as connect with other people dealing with the same concerns. Andrew and I talk about his personal motivation, his health moonshot, and why in health, knowledge really is power. Enjoy. Andrew Rosenberg, CEO and founder of Responsum Health. Thanks for taking the time to catch up with me today.
Thank you, Logan. Pleasure to be here.
So with Responsum, you're building a new way for people to get health information for their lives, for consumers. We'll get into kind of the nuts and bolts of what you've built with Responsum, but I want to start with the challenge. Can you outline for me kind of what you saw as being broken in the way people search for medical information?
Absolutely. So I'll just explain it the way it happened to me. You or a loved one gets a diagnosis of a chronic or rare condition. First thing you do is you run home and you go online. It's what everybody does. And the internet sort of presents this sense of opportunity to learn, and that there's a great resource out there just at your fingertips. But the reality is different. And as we all have become really conscious of in the last year, but we started this year, and outdated and inaccurate information online. Beyond that, a lot of the information that you'll pull up if you search around your new disease may be overwhelming, might be difficult to understand. It's very possibly not relevant to you. So what we've aimed to do is to essentially provide a mechanism, a team, if you will, that effectively performs a search for you every day. And not only are we putting information in front of you that would mirror an informed search, but we're vetting the content. We're editing the content. We're making it easy to use. We're keyword tagging it so it's easy to look up and to research. And we're doing it, and this is the key, is we're doing it in partnership with leading patient advocacy groups in each area in each disease group.
So this came out of a personal experience. That's what you suggested at the beginning?
Yeah. Well, I mean,
what happened to you?
My mom. It wasn't me. But she wound up getting diagnosed with a very difficult condition that there was very little known about, and we tried to be helpful to her, and we tried to help her with thinking that we could perform searches for her, figure out some answers for her, and in reality, we couldn't. It was. My sister works at National Cancer Institute. She couldn't even be helpful. I'm a healthcare lawyer and policy person from Capitol Hill by training, and it was really difficult to figure out what was real and what was not.
So you're thinking, if we are having this trouble, then just imagine everybody else if they don't have the resources that you have and the experience that you have.
Yeah, that's exactly right. I mean, you have the sense in this economy, or in where we are today, that you can get help, that there are people out there that will help to guide you through these sorts of things. In reality, it doesn't exist, or it didn't exist before Responsum.
Okay. So Responsum Health, so you've started to outline it. Kind of what does the product look like right now? What do these guided information sort of outlets look like?
So they're apps. So for each disease, we've got 4 currently that are that are out in the market serving thousands of patients with these 4 different conditions.
Which four, just for our viewers?
Yeah, so we started with pulmonary fibrosis, and then we also have platforms in chronic kidney disease, glaucoma, and uterine fibroids.
Okay. And those are in partnership with organizations? Got
In
it.
each of those areas, we have 1 or more partners of leading patient groups that have a really trusted relationship with patients, and also bring a lot of scientific and lifestyle expertise. So when we are vetting and providing this news feed essentially to patients, they know that it's all being vetted and curated in partnership with a trusted organization. And then
So
each of these platforms, if I may, I mean, they're all supported by a commercial supporter. That's sort of the model. So also if there are drug companies in particular that have an interest in supporting a community around a given therapeutic area, they might work with us to build one of these platforms.
Got it. So, I mean, in its own way, it's a new form of curated media. I mean, you're in the media business, but you're bringing a sort of a different type of scientific curation than maybe was there before.
Yeah, we didn't really think about it at the time that that's what we were doing, but that is essentially what we're doing. We have a team of writers and editors that we're not creating our own, we're not creating new content so much as curating what's out there on the web and then translating it and creating summaries that are easy for folks to read.
Got it. So in terms of user experience, let's say I'm somebody with glaucoma. I find out about Responsum Health, and I found out that you have a vertical and an app for glaucoma. I start receiving a feed of vetted information, scientific information about glaucoma into my app. Is that right?
Well, it's more than just that. So you would sign up for the app, and you would get a daily feed of content that we're pushing. But it's not just scientific information. It's not just about treatment. It's about living with. So it's about diet and exercise and travel and financial and emotional, anything that you could imagine that you might want to learn more about. We're patient blogs, videos, clinical trial information, anything like that you might want to find out about. We're pulling that all off the web and we're giving it to you in a dynamic, entertaining, visually appealing, hopefully uplifting news feed. And then each app also has other pieces built into it. So there's a community chat element of it. And I should say the news feed is also, it's community rated. So users, patients are encouraged to rate the articles on whether they find it informative or interesting. They're encouraged to share it, and they're encouraged to leave comments. So between that and the community chat and a couple of other features that help patients to store disease-specific information, like with drop-down menus so that they can track their own therapies and medications and treatments. It's all in one place.
Interesting. That community element is interesting. One of the trends that I've noticed talking to health innovation founders are companies or products that feel like a reaction to our current social media landscape. The idea that maybe we thought we could get certain things out of a social media group, support for a disease, et cetera, information, and many times it left us wanting. And so these platforms, various programs have cropped up as an answer to that. Do you feel that way with Responsum at all?
Well, I think we're actually feel like we're improving upon what's out there, which there have been a number, and there are communities that are built around basic chat rooms, but sometimes they struggle. I think they work for some patients and not for others. For starters, some people want to be part of that sharing experience, and other patients don't. But for those that do, what we offer is it's a moderated community. So we're making sure that there are, again, patient group partners that are monitoring it, that are sharing advice, information. It's also structured around the content. So we have a natural language search that goes through, and let's say somebody is writing a comment around a diet issue or treatment issue or given issue that they're having with some sort of element of their disease. You can click on that, or you can hover over it, and it pulls up all of the articles from our library that we've curated on that topic. So it's intended to be a little bit smart. I don't want to say it's a smart chat room, but it's a little bit more content based than just sharing stories.
No, that makes sense. That makes sense. You mentioned that there's a way for me to, as a user, there would be a way for me to input my own information and personalize it. That's unique to like sort of the chat concept. Why was that important to you, and kind of where do you see that building towards?
Well, so we have what's called the patient one sheet, which is, yeah, and that was the idea of one of our patients. So I should say that this all started through a research project at Carnegie Mellon University about 4 or 5 years ago, where we interviewed, and over the course of developing this, literally hundreds of patients to try to understand their pain point, if you would, in terms of where they get helpful information, as well as what sorts of tools would they like to see on an app. And one of the frustrations that patients have is that every time they see a new doctor or a new specialist, they have to fill out new forms. And it's difficult to remember all the medicines you're on and the dosages, as well as all the other information around insurance, et cetera. And so what we've created is for each disease, it's essentially it's a patient one sheet with a drop-down menu of fill-ins, if you will, around the most common treatments and dosages, comorbidities, et cetera, for each given disease. And so a patient can upload this, save it, print it, share it if they want to, so that they don't have to refill out a form every time they go to the doctor. At least they have their cheat sheet with them. Yeah. But in addition to that, we've linked that to the news feed so that there's an algorithm that's working behind the scenes, and it sees that if you're on drug A, you're going to be pushed articles that come out on drug A into your news feed. Okay. So we're going to try to, that's just an example about the drug A. It could be that you're a male versus a female. It could be that you have a certain preference, or you have a certain comorbidity, and then we're going to drive content that we think will be of interest to you. Interesting.
One of the things I think I find interesting about Responsum is that you began with an individual vertical. You started very specific, you kind of honed in on a chronic disease, and then you've started to replicate that, create new communities, and the growth potential there. There are so many of these verticals and communities that you could grow into. What do you feel like, I think you're at 5 verticals now, and I'm sure there's planned for many, many more. What do you feel like you've learned now that you've launched your 5th, having started with one single community?
Well, each community is different. The needs, the demographics. So when you're creating an app like this or a platform, the imagery, the language, even the topics have to be reflective of that community. And as a result, for each of these platforms that we build, we either partner with, like I said, patient groups or multiple patient groups, or we build a content or an expert advisory council of patients and providers in a given space. And they keep us true to the patient experience and to the patient's needs and desires. So, for example, we have certain conditions that are exclusively, well, one is exclusively women, uterine fibroids, largely women of color. And so finding the right mix of imagery and topics is really going to be very different than for pulmonary fibrosis, which is an older population. Their use of the internet is different. Their use of platforms is different. For each of these apps that we build, each of these communities, we also launch channels in Facebook, Instagram, and Twitter. And that's a means of sort of pushing out our content, becoming players and respected partners within a given community. But what we find is, as you could imagine, for these different diseases that have different demographic profiles that people congregate, digital communities congregate in different places online. Facebook could be a very different crew than fibroids, than glaucoma. So that's one thing that we've learned. But for each of these, getting engagement, how you attract people to sign up, how you make them aware of it, it's different for every community. It's what makes it exciting and challenging every time we do this. And quite frankly, I think it's a real differentiator for us because it's not easy. It's the easier thing to do, as what has already been done, is for a company, quite frankly, to sort of slap up a social wall, a community chat, and make it identical for any disease can sort of like participate. But what really works, I think, for us is the customization around each disease. We had to develop accessibility issues, glaucoma app, for example, to make it easier for people who are sight impaired to use it. And that then we wound up using in other ones as well. But for each of these, again, we're finding a new challenge that we have to overcome.
Interesting. So that personalization is what really is driving engagement. I wonder what other sort of challenges you've identified in the market that maybe you didn't anticipate, just in terms of the amount of data in the market, and just what it takes to really pull that together in a meaningful way.
Yeah, well, I mean, it's complicated. There are a lot of things going on out there. And I think that one of the things that helps us to cut through is invest the time to build relationships with existing voices and thought leaders in patient communities. We're not coming in and trying to dominate or do something that supplants anybody. We're coming in to a lot of these patient communities and patient groups that are somewhat resource limited, and would probably love to be able to offer this sort of a service, a daily updated newsfeed service that's vetted for free to their patient community. And so they're excited, and they've been amazing partners in working with us, because it's a value that they get to drive, that they get to provide to their community, and we're thrilled to be their partners.
Nice. Okay. Last question. What are you most excited about for 2021? Are there new verticals that you're moving into that you can announce, or just generally where are you hoping to take Responsum in 2021?
Yeah, well, we're certainly open for business and want to do more with more. We've got amazing partners, companies like Otsuka and AbbVie and Allergan Foundation, and now our latest with Galapagos. So we've got phenomenal corporate partners and supporters for these projects. The things that we're really going to be doing in 2021 is continue to build these communities that we have right now into make them larger, begin to learn from them. So we survey our communities and learn and share this with our corporate supporters, information obviously de-identified, but about the lived experience. What are these patients going through? What do they care about? What are they experiencing? And then secondly, we're really excited about a partnership we have right now with Galapagos to be recruiting patients for one of their clinical trials in pulmonary fibrosis. So once we are able to build these communities through this app, we're able to work with these patients to learn from them and to provide them with opportunities to get involved in clinical research. So that's really an exciting evolution for us. I don't have any new disease apps to gloat about or to share with you today, but we're certainly having some exciting conversations with some companies and are really bullish on 2021.
Nice. Okay, I lied. Follow-up question. If you look forward and you think about Responsum really taking off, the ideas that you have initiated and the seeds you planted really taking root and growing, how would you describe the better patient experience let's say 3 to 5 years from now, because Responsum really succeeded?
Yeah, I mean, our dream would be that for every chronic condition, that patients have a trusted place to go to keep up to date with the latest, not just in treatment options, but in lifestyle, how to tackle lifestyle challenges, and that better informed patients are more empowered to engage with their doctors, with the healthcare system, to make better decisions, and then to drive better outcomes. So our long-term goal and our deep held belief is that Responsum patients are going to be smarter, are going to feel more empowered to make decisions, and ultimately will enjoy better outcomes. Our goal is to be able to demonstrate that over time.
Awesome. All right. Thanks, Andrew. Thanks for your time. Thanks for all the work that you're doing to empower patients, educate them, and I wish you the best.
I really appreciate it, Logan. Thanks for having me today.
All right. Be well.